Hi guys, welcome to my YouTube channel Health with Esther. My name is Esther and I'm a pharmacist. On this channel I'll be talking about women's health, fitness and everything in between. If this is the kind of content you enjoy, then you're in the right place. Please subscribe because I'll be bringing new content your way every week and you won't want to miss it. Stay tuned. In today's video we'll be talking about 3 most common vaginal infections, and they are bacterial vaginosis, VULVO-VAGINA, CANDIDIASIS and TRICHOMONIASIS. So I'll be telling you the risk factors, their symptoms and how to prevent them. Let's dive right in. The first and the most common vaginal infection is bacterial vaginosis, and this is caused by an overgrowth of the bacteria that exists in the vagina. So naturally, microorganisms exist in the vagina, and these microorganisms include both bacteria and fungi. So anything that would cause an imbalance of microorganisms in the vagina can lead to an overgrowth of bacteria, and this is what we refer to as bacterial vaginosis. Some risk factors of bacterial vaginosis, that is things that can increase your chances of getting infected, include having unprotected sex, weak immune system, antibiotics abuse, which may be using antibiotics without a prescription or not using them the way they've been prescribed, and dodging. If you don't know the meaning of dodging, I spoke about it in my previous video. I'll leave the link in the description. Please do well to check it out. Some symptoms of bacterial vaginosis include gray or whitish discharge with fishy smell, itching, and a burning sensation when urinating. So how do we prevent bacterial vaginosis from occurring? The first thing is to always practice safe sex, that is, use protection during sex. Avoid dodging. Please do not dodge for any reason, and always eat a healthy diet. When you eat a healthy diet, it helps to boost your immune system, and this in turn can fight off infections easily. Always include foods like yogurt, fruits, and vegetables. Bacterial vaginosis is treated with antibiotics. I'll talk more about this at the end of the video. The next and the most common vaginal infection is vulvovaginal candidiasis, which is also known as yeast infection. And this is caused by the overgrowth of fungi in the vagina, specifically the overgrowth of the fungus candida in the vagina. So again, like I said before, anything that will cause an imbalance in the microorganisms in the vagina and will increase the growth of the fungi can lead to vulvovaginal candidiasis. Some of the risk factors of yeast infections include weak immune system, abuse of antibiotics, dodging, and wearing tight underwear. I explained these points properly in my previous video. Please do well to check it out. Some of the symptoms of yeast infections include itching, thick white discharge, pain when urinating, and vaginal inflammation. If you've been watching this video from the beginning up to this point, you will notice that both bacterial vaginosis and yeast infections have similar risk factors, similar symptoms, and I would also like to mention that they have similar preventive measures which include eating a healthy diet, wearing breathable underwear, avoid dodging, and also use your antibiotics the way it has been prescribed. The major difference between the two of them is their causative agent. When the imbalance of microorganisms in the vagina favors more bacterial growth, we have bacterial vaginosis. But when it favors more fungi growth, we have vulvovaginal candidiasis, that is yeast infection. Yeast infection is treated with antifungal agents. I'll be talking more about this at the end of the video. The third most common vaginal infection is trichomoniasis. This is a sexually transmitted infection caused by a parasite. Risk factors of trichomoniasis include having unprotected sex, history of other STIs, and a previous episode of trichomoniasis. This means that having trichomoniasis increases your chances of having it again in the future. Some symptoms of trichomoniasis include itching, lower abdominal pain, yellow or green discharge that is foul smelling, pain during sex and while urinating. How do we prevent trichomoniasis? The first and the most important way is by having protected sex, that is using protection during sex, and going for regular STI screening. This would help catch the infection on time and also treat it properly. Trichomoniasis is treated with antibiotics. So if you notice that you are experiencing any of these symptoms for either bacterial vaginosis, yeast infection, or even trichomoniasis, and you need to be treated, please visit a medical practitioner. So we've come to the end of this video. I hope you learned something. If you have any questions, please leave it in the comment section. Don't forget to subscribe and like this video. Till I come your way next week. Bye.